Where did you find such a large piece of poster board? I'm curious.
Was it?
Michael's.
Yeah, Michael's.
Oh, okay. Nice visuals. We can see the music back there.
It's the biggest one they had.
A mother of 5 with an unusual addiction, eating sofas. Adele Edwards says that she's been eating the foam inside couch cushions for 21 years. In January, she was featured on TLC's My Strange Addiction. Take a look.
I just take little bite-sized pieces and snack on it all day. Sometimes I'll just go on like a binge where I'll just keep going for like 20, 25 minutes straight of just eating cushion.
The disorder.
Have you ever had a craving for a particular food? Most of us have, and it happens on a regular basis. Imagine having an appetite for cigarette butts, hair, and even feces. A recognized eating disorder called pica causes people to have these cravings and consume non-food items. I became interested in this topic after watching an episode of My Strange Addiction on TLC. First, I will discuss the causes. Second, I will discuss different forms of pica and what is actually ingested. And last, I will explain treatment options to help these individuals. Pica is most common in certain people with developmental disorders. This includes people with autism and also mentally handicapped. It affects children between ages 2 and 3, and it affects some pregnant women. Mentally handicapped individuals will likely suffer from pica due to inability to discriminate between food and non-food items. According to an article published by Gary Wickman, it states, in the case of conditioning such as autism, it can be curiosity or a result of self-harm and repetitive behavior. Pica is a constant concern for these people. Children are more likely to have pica due to lack of supervision, or it can be a learned behavior from a parent that suffers from the same disorder. Pica usually tapers off as the child approaches adolescence. Pica is often temporary in pregnant women, and it's typically related to a vitamin or nutritional deficiency. A lack of iron can trigger cravings and reduce adrenaline levels. People affected by pica develop distinct appetites that can be classified as different forms, and it's determined by the things that they're actually ingesting. For instance, geophagia is the consumption of any earthy substances such as clay or dirt. Ameliophobia is the consumption of cornstarch or laundry starch. Pagophagia is the consumption of ice. Other items that do not fit into categories of pica include cigarette butts, buttons, toilet paper, hair, toothpaste, glue, soap, coffee grounds, and paint chips. Obviously, many risks are involved with the consumption of these items, possibly even death. Pica is linked to lead poisoning, intestinal blockage, parasites, and many need surgery to remove the items. It's very important for these people to seek treatment. There are a few methods of treatment, and each case is treated individually because they want to try to understand what actually causes this condition. Mineral and vitamin deficiency is usually treated by replenishing nutrients with diet or supplementation. This has been known to decrease unusual cravings. Educating the family can help monitor the patient's behavior and provide ongoing support. Patient education involves teaching them healthy eating habits and also informs them of the dangers of pica. If a patient is no better with nutritional or supplementation or education, a doctor may refer them to behavior or psychological counseling. The counseling may help identify any negative thought patterns and address any underlying stresses which actually cause the condition. If all these treatments fail, medication will be used. And this is used to manage the behavioral problems. Drugs that are used for depression have been shown to prove effective for this type of disorder. It is unclear how many Americans suffer from pica because it goes unrecognized and is underreported. It's largely due to the embarrassment of the patient about bizarre habits, or they don't see themselves as having any odd behaviors. It's also difficult to diagnose pica, and it's usually reported by family and friends that witness this bizarre behavior. People with developmental disorders, children ages 2 to 3, and some pregnant women are most likely to be affected by pica. The most common forms of pica are geophagia, ameliophagia, and pagophagia. Nutritional intervention, education, behavioral therapy, and medication are known treatments for the disorder. Pica is usually temporary in children and pregnant women. However, individuals with developmental or mental health issues may experience pica for prolonged periods. I hope that you found this topic as intriguing as me, and hopefully I satisfied some of your curiosities about pica disorder.